Well, if you have allergies, you probably had a few sleepless nights this spring, which is interesting. But are those restless nights allergies, and when are they the sign of something much worse? We'll explain when we come back. We have an expert.
Welcome back, everyone. Allergies. We have certainly suffered pretty badly, actually, this year so far. The runny nose, the watery eyes, stuffed up head, you know what I'm talking about. All that pollen and dust can also destroy a good night's sleep. But when you aren't getting enough quality rest, is it allergies or could it be something else? That's why we have Patti Day. She's a sleep expert from the Valley Sleep Center. Thank you for joining us this morning.
Well, thank you for having me.
Is there a correlation between the seasonal allergies and sleep?
Absolutely. And you know what? The biggest thing is that we see that patients that suffer from allergies also suffer from the daytime sleepiness that we see from the sleep deprivation caused by different disorders. So it's important to remember that we need to get that good night's sleep, but that if we're suffering from complaints of tiredness and can't function at work, that maybe there is something else going on that once the allergy season is over, you're still going to be suffering from.
It keeps lingering. So that's when you know it's deeper than the allergies, obviously.
Exactly.
And what's the best way to get diagnosed, or how to figure out what to treat? Because what's some of the more common problems that you guys are seeing?
Well, we see a lot of patients complaining of like daytime sleepiness, difficulty functioning on the job or, you know, in their daily activities.
I may qualify for this.
Well, and then things like extreme, like driving, you know, nodding off and sleeping while driving. And that's, you know, really important to address that.
Sure.
So when our patients are complaining of stuff like I snore at night, my partner's complaining that I snore, or they're afraid because I stop breathing at night. So then they come in and they go through a diagnostic test. The first line of defense is to definitely talk to your physician.
Okay.
And then determine what type of testing, if any, is necessary.
And that's when usually someone will be referred to you guys by a doctor to go ahead and do a sleep test.
Correct.
And you brought some things here. What exactly is this contraption here?
Well, this is a CPAP mask.
Okay.
So this is a positive pressure device here, which is the CPAP therapy. So what we're doing is we're delivering a positive pressure to essentially splint open that airway. So we're relieving the obstruction that is causing the closure of the airway while you're sleeping. This is the device itself. There's a tubing that goes to the mask, and it's that positive pressure. The nice thing about it, as you can see, it's very portable. So a lot of our patients travel, and it makes it really convenient to be able to.
I think my dad just recently got one of these because he was telling me about this mask that he's now wearing because he was diagnosed with sleep apnea. Is sleep apnea probably the more common issue that you guys see with folks who are suffering from sleep deprivation?
It definitely is. That is the main diagnosis that
we see. And what exactly happens with sleep apnea?
It is an obstruction of the airway. So by that we mean it could be tonsils, adenoids, it could be an elongated palate, it could be your tongue falling in way. Oftentimes, weight of the neck can even lead to an obstruction of your airway. That's why they've always said athletes are at a high risk for sleep apnea, or patients that suffer with obesity.
And unfortunately, so many people go undiagnosed because they just think, well, snoring is a part of it, and not realizing that maybe they are stopping to breathe in the middle of the night, which of course can be dangerous and deadly.
Very much so. And the thing about sleep apnea is it does exacerbate other sleep or other diagnoses. For one, high blood pressure. You know, you're predisposing yourself for things like stroke and heart attack when you have sleep apnea and a cardiac condition and it's going untreated.
So if someone's watching this right now, they're saying, oh geez, I have a hard time staying awake while I'm driving. Oh geez, I definitely have bouts of, you know, being up all night or being awoken by maybe just uncomfortableness or difficulty breathing. Oh boy, I snore. What would be the best thing to do? First, see their doctor.
They need to see their physician.
Okay.
And what's nice about it, Valley Sleep Center, is we do have board certified sleep physicians on staff.
Okay.
So they can actually come in and consult with our sleep specialist, see the facility, have their testing done there, and we actually let them tour the lab. So one of our main questions is how I'm going to fall asleep that night. Well, they get to acclimate a little bit to the facility prior to coming in, and it relieves that anxiety of sleeping outside of your home environment.
And they actually spend the night there, so you guys can diagnose.
Exactly.
Okay, very good. Well, Patti, thank you for shedding some light on the sleep issues that I think a lot of people probably do suffer.
Yes.
We appreciate it. And if you would like to contact the Valley Sleep Center, of course, we have all the information on azfamily.com.